This is NNI Bites, Big Learnings, a podcast where fellow healthcare professionals converse about the latest on nutrition science. Join us as Ranan Shamir and Elvira Verduci share their knowledge and insights on feeding practices in the introduction of complementary feeding and implications for future healthy eating.
Welcome to our podcast, NNI Bites, Big Learnings. My name is Ranan Shamir, and it's my great pleasure to welcome Professor Elvira Verduci from Milano, Italy. Elvira Verduci earned her medical degree from the School of Medicine at the University of Milan, and in 2003 completed her specialization at the Postgraduate School of Pediatrics. In 2006, she obtained a PhD in clinical nutrition from the University of Milan. Currently, she is an associate professor of pediatrics at the University of Milan and is the head of the Division of Metabolic Diseases at the Department of Pediatrics, Vittorio Bucci Children's Hospital in Milan. She also acts as the designated contact for the Rare Disease Registry at Vittorio Bucci Children's Hospital, focusing on congenital defects in amino acid metabolism and transport. Since 2002, she has participated in various European community projects, primarily addressing topics such as metabolic programming and childhood obesity. Since 2022, she has been the chair of the Special Interest Group of Childhood Obesity and European Society for Pediatric Gastroenterology, Hepatology and Nutrition, ESPEGAN. And at the national level in 2022, she was appointed by the Italian Ministry of Health as a member of the Technical Committee on Nutrition and Animal Health, specifically in the section for dietetics and nutrition. Professor Verduci, it is an honor and great pleasure of having you with us today. Today we're discussing your paper on feeding practices in the introduction of complementary feeding and implications for future healthy eating, which appears in our latest issue of Annales Nestlé. Professor Verduci, would you like to say a few words to our audience before we begin?
Yes, thank you, and thanks to you, Professor Shamir. It's a great pleasure and opportunity for me to speak about complementary feeding in this moment, and it's a very important topic for the future health of infants.
Thank you. Now, your paper is part of a series on complementary feeding and future health, and our hope is that many of our listeners will enjoy our podcast and your paper and be able to use the information to improve children's health. So let's start by defining complementary feeding.
And the complementary feeding is a process of introducing foods while the breast milk or formula alone can no longer meet infants' nutritional requirements. Traditionally, we know the terms of weaning, but now the term of complementary feeding is preferred because we want to stress the concept that the goal of introducing solid foods is to supplement, not replace human milk or infant formula. And I like to underline that the complementary feeding is a critical period for established healthy dietary practice and flavor preferences.
Thank you. Now, we know, and you already alluded to it, that exclusive breastfeeding is the nutrition of choice for our newborns. Why is it important to introduce complementary feeding?
We know that the breast milk is the optimal source of nutrients for the infants, but we have to consider that beyond 6 months of age for the general population of healthy infants, the breast milk is not able alone to meet the needs for energy and protein and micronutrients, for example, zinc and iron. So it's important to introduce complementary foods because these foods can help fill the nutritional gap between the total needs of a child and the amounts provided by the breast milk.
Okay, so is there a time window when it should be introduced? Or in other words, what is the risk of introducing too early and what is the risk of introducing complementary feeding too late?
Yeah, the age of introduction of complementary foods is of fundamental importance for the future health. We know that according to the Afghan Committee on Nutrition, complementary foods should not be introduced before the 70 weeks of age, but should not be delayed beyond 26 weeks. We know indeed that if the complementary feeding is introduced before 4 months, we can have some negative effect, for example, renal and gastrointestinal impairment. And moreover, this can be inadequate for the neurodevelopment skill. But if we consider also the introducing complementary foods after 6 months, it could be inadequate from the nutritional point of view, particularly for iron, because we have to consider that by 6 months of age, the infants' iron stores can be depleted, and the need for exogenous iron increase very rapidly with the growing.
Thanks. Now, moving to another issue of the time of introduction, recently the World Health Organization stated that complementary feeding should be introduced at 6 months of age. And this was mainly due to the high rate of early introduction in low and middle income countries and safety issues involved. Can you relate to the safety of introduction at 4-6 months of age?
Yeah, the window of introduction of complementary foods between 4 and 6 months has been generally considered as safe, particularly in high-income countries. Now we know that recently the WHO stated that the infants should be introduced to complementary foods at 6 months of life, but while continuing to breastfeed. It is was graded as strong with low certain evidences. But we have to consider that the introduction of complementary foods before 6 months of age can have a potential negative effect, particularly in low medium income countries, because in these countries, for example, we have a problem related to the setting. So we have food and water hygiene as an issue, and in these countries there is a problem related to the viability of proper complementary foods with good nutritional quality. So it's not, we can consider that this recommendation more related to low medium income country, while if we focus on high income countries, we have to consider more aspects related, for example, introduction of allergenic foods and development readiness that were omitted in the statement that WHO made. So we have to consider 2 different settings.
Oh, thank you for clearing that. That was my next question about the differentiation between low income and high income, but you already elaborated on it, so thank you. So this is the mother's decision or the father's decision of the timing. Now let's move to the child itself. We talk about timing. The infant should be ready to accept this timing. How can a mother know that her infant is ready from the neurodevelopmental aspects?
Yeah, this is very important because underline the relationship between the parent and the infant's behavior. And for example, when the infant is able to sit without support, this is a gross motor skill indicative of readiness for consuming spoon-fed pure food. And this motor skill can be observed in some infants at 4 months of age. Obviously, we to consider also during the complementary foods other motor skill that can indicative for other type of behavior. For example, we know that from 9 months a child can be able to drink from a cup by using both hands. And it could be related, for example, to the ability to finger foods feeding. And it's important to consider all these aspects and these neurodevelopmental aspects by the parents.
Thank you. So this is the readiness, but what about the interest of the infant? Is that important?
Yes, it's really important too, because it's such as a trialogue interrelationship between the infants, the parents, and the foods. So the child show interest towards the foods, interest when the family is eating, and so it's signals that the child is ready to start the introduction of solid or semi-solid foods.
Thank you. Now, in my clinic, and I'm sure in yours, we observe many mothers with difficulties in feeding their children. Can you elaborate on important aspects of the child-mother interactions, especially the issue of responsive feeding and parenting style, and how they can support the child eating experience?
Yes, the evidence show that the responsive feeding is associated to more normal or physiological eating behaviors. So the parents have to be learned to respond to the child signals. Otherwise, if you consider the parenting style, so on the contrary, if the family put pressure to hit control behavior, is a negative behavior from the parents, because it is associated with a negative eating behaviors, or for example, neophobia. So it could be related the parenting style to negative or non-appropriate eating behavior.
Thank you. Thank you, Professor Verduci. Now, let's move to the impact of complementary feeding on preventing diseases. I would like to start with food allergy. By the way, we have a full podcast dedicated to the prevention of food allergy, but let's touch upon major issues in this context. A recent systematic review by Scarpone and colleagues showed that earlier introduction of multiple allergenic foods under 12 months of life was associated with reduced IgE-mediated allergy to any food from 1 to 3 years of age. Can you give us a short summary of evidence for the major allergenic foods, starting with cow's milk?
Yeah, this is a very important topic, and we know that according to Hesgan, there is no evidence that delaying the introduction of allergenic foods reduce the risk of allergy, and is either for infants in general population and for in case of a family history of atopy. But if we consider also that according to this evidence, allergic foods can be introduced when complementary feeding is started anytime after 4 months. And if we consider in particular cow's milk, we have to consider that cow's milk is a potential allergenic food, but is not adequate in the first year of life, not only for the allergenic point of view, but also because is a poor iron source and provides excess of protein and energy especially when is used in large amounts. So it should not be used as the main drink for before the 12 months of age, Also, small volumes may be added to complementary foods, and also you can consider that if the child is breastfed and the mother is on free diet, small amount of cow's milk can reach the infants through the breast milk, but it's physiological and probably is a potential against the cow's milk allergy.
Thank you. And what about eggs?
The authors of the systematic review that you mentioned show a high certain evidence that early introduction of egg between 3 and 6 months of age and an earlier introduction of peanuts between 3 and 10 months of age was associated with a decreased risk of egg and peanut allergy. According to this evidence, we have not delayed the introduction of potential allergenic foods.
Okay, so you told us about cow's milk, about eggs, and also about peanuts. Now, taking you a bit away from your review, as exposure is important within a time frame, should we introduce food items one at a time or a combination of foods?
This is a tricky question in the sense that original or in a traditional way, we are commanded to introduce one by one foods with a few days of delay. And if you consider otherwise another behavior, so to introduce a combination of foods, we have to evaluate pros and cons. Cons could be a potential obesity because we have the combination of foods, so the risk of increase the amount of energy and protein. But also we can have pros, so an early achievement, an early introduction of potential allergenic foods, and so we can use better the windows of opportunity, but is debated this topic.
Well, indeed, a complicated matter.
Yeah.
Now, when we introduce food items, one of the questions is gluten introduction and prevention of celiac disease. First, obviously, celiac disease is not a food allergy. It is an autoimmune disease initiated by exposure to gluten in genetically predisposed individuals. But can you educate us about whether the timing of introduction of gluten is important?
Yes, you state that celiac disease is an autoimmune disease, and according to the ESGAM position paper, the evidence states that gluten may be introduced into infants' diet anytime between 4 and 12 months of age. So the age of gluten introduction in infants don't seem to influence the absolute risk of developing celiac disease during childhood, obviously because it's an autoimmune disease. So probably the mechanism related to the onset are different.
Okay. Enough about celiac disease. Another important aspect of early introduction of complementary food is the risk of obesity. We have a podcast dedicated to this issue, but can you summarize your thoughts about early introduction of complementary feeding and obesity?
Yeah, we have a prospective longitudinal studies that involving 1,000 children that found a relationship between the introduction of complementary foods before 4 months and increase of adiposity. You also, for this topic, we have to consider different aspects because we know that, for example, low, medium income countries have other type of critical issue and nutritional problems. Otherwise, in a high, income countries, the problem of obesity is of major importance. So we have considered and further research is necessary to provide a clear understanding of the relationship between early complementary foods introduction and the risk of developing obesity.
Thank you so much. Professor Verduci, there is so much material in your excellent paper that we cannot hope to cover it all. For example, we did not touch on the issue of flavors and textures. Thus, I strongly urge listeners to download a copy from the NNI website. So perhaps we can wrap up by asking you to summarize what are the recommendations for complementary food introduction.
Yeah, the main key of the complementary feeding is that this is a very important process, is a critical phase in the child development and represents a window of opportunity to define the future health of the child. On the timing of introduction of complementary foods, different aspects have to be considered. The setting, but also the acquisition of feeding milestone and the oral motor skills, the dietary preference. So at the end, it's clear that one size fits all. This type of approach is not desirable for complementary feeding. We have to consider individual needs, cultural practice, and resources, so the setting to consider the correct, the personalization of introduction of the complementary feeding, how to proceed in the introduction of the foods.
Thank you so much, Professor Verduci, for walking us through this fascinating topic so clearly and helpfully. Let me end by summarizing Professor Verduci's key messages, and I apologize if I repeat some of her summary. You told us that regarding the timing of introduction, the setting should be considered and then tailor timing according to high-income countries and low-medium-income countries. You told us that exclusive or full breastfeeding should be promoted for 4 months. It's 17 weeks, beginning of the 5th month of life, and exclusive or predominant breastfeeding for approximately 6 months is a desirable goal. In populations affected by food allergy, complementary foods with high allergenic potential may be introduced in an age-appropriate form once complementary feeding begins. And during complementary food, consider the acquisition of feeding milestones, which include feeding skills, cup drinking, food texture, and self-feeding, and responsive feeding practice to promote better feeding behavior and self-regulation. So, Professor Verduci, it has been a pleasure and true honor to have you share your huge experience, and I hope we have another opportunity soon to widen our knowledge and share your vision on a healthier future for children.
Thank you, Ranan, and thank you. I hope I enjoyed the podcast because this is very, very interesting topic for the future of our infants.
So thank you, Professor Elvira Verduci. Thank you, our audience, for listening to this very special edition of our podcast, NNI Bites Big Learnings. Please subscribe through the NNI 365 app to ensure you don't miss future offerings.
And that concludes today's episode. Thank you for joining us with Ranan Shamir and Elvira Verduci as we talked about feeding practices in the introduction of complementary feeding and implications for future healthy eating. We hope you enjoyed and learned from this quick discussion, fellow experts. Till the next episode.